Hi guys, good morning. So today we are going to discuss our next topic, that are the orthopedic appliances. See, in this, when an orthodontic patient comes to you with a chief complaint of the retrognathing mandible, right? If he comes to you at his growing age, so you will correct his skeletal changes either with the help of by giving the myofunctional appliances. If he comes to you at a known growing age around 16 to 17 years of age, then you treat this patient as with the fixed appliances, like with the braces. When a patient comes to you with the retrograde mandible at the age of 20 or more than 20 years, at that point of time you plan for the orthognathic surgery. Fine. So after this, let's discuss what is the basic difference between an orthodontic force and an orthopedic force. So the orthodontic forces, these are the forces that are applied to the teeth, and these are applied by means of wires, by means of removable and the fixed appliances. In the orthodontic forces, these are the light forces which produces the 50 to 100 grams of the force. While coming on to the orthopedic forces, these are the forces that brings about the skeletal changes, right? So they produces a very heavy forces like 400 grams, right? And it is helpful in brings about the skeletal changes. So two important points: the amount of the force of an orthopedic appliance is 400 gram, and the duration of the orthopedic appliance is the patient have to wear the appliance for about 12 to 14 hours in a day. Important points. So the orthopedic appliance, they consist of three types: the headgear, the face mask and the chin cup. So we are going to discuss them one by one, starting with the headgears. So the headgears, these are basically used during the growth period. The headgear face bow assembly, it consists of three main components: the face bow, the force element, head cap and the cervical strap. Starting with the face bow, so this is the face bow. This is the face bow. Fine. So it is made up of a metallic component, and it helps in transmitting the extraoral forces onto the posterior teeth. Right? So the face bow, it consists of an outer bow, it consists of an inner bow, and it consists of a junction. This is the junction. So the outer bow, it is made up of 1.5 mm of the stiff round stainless steel wire, and the outer bow, it can be of three types. It can be short, it can be medium, or it can be long. Right? First is the short labial bow. First is the short face bow. It means the outer bow, this is the outer bow, it is lesser as compared to the inner bow. So the short face bow, so there is a tendency to steepen the occlusal plane. Very important point for your MCQ. Fine. Coming on to the medium, it means the length of the outer bow is equal to the length of the inner bow. While the long face bow, it means the outer bow, it is larger than that of the inner bow. In the short one, the outer bow is smaller, and the longer one, the outer bow is longer than that of the inner bow. So there is in the long face bow, there is a tendency to flatten the occlusal plane. In the short labial bow, in the short face bow, there is a tendency to steepen the occlusal plane, while in the long face bow, it has a tendency to flatten the occlusal plane. Right? Important point is that this is the inner bow. It is inserted into the buccal tubes which are fixed onto the maxillary molar. Right? Now next is the J hook type face bow. commonly asked MCQ. This is the J-hook type. So it helps in the retraction of the anterior teeth. Right. Second component is the force element. So the force element, they provide the force to bring about the desired effect. These can the force element, it may be the springs or it may be the elastics. So the force element, they connect the face board to the head cap or to the neck strap. Third component is the head cap or the cervical strap. So it takes the anchorage either from the head or from the cervical area, basically the rigid bone of the skull. Right? So these are three important points commonly asked. Center of resistance in the dentition. The center of resistance for a molar, it is usually lies at the mid-root region. The center of resistance of the maxilla, it is commonly asked. It lies at the posterior-superior aspect of the zygomatico-maxillary suture. Very important. Third one is the center of the resistance of the dental arch. So it is located between the roots of the premolar. These 3 points are very important for your competitive point of view. Coming on to the types of the headgear. So in this we have 5 types of headgear. We have the cervical headgear, we have the occipital headgear, we have the combination, vertical pull, and the asymmetrical headgear. Starting with the first, that is the cervical headgear. It was given by Silas Siloan in 1947, and it is obtained, the cervical headgear, it basically obtained the anchorage from the nape of the neck. Important. And the cervical headgear, they mainly cause the extrusion of the maxillary molars, which leads to the increase in the lower facial height. It moves the maxilla as well as the maxillary dentation in the distal direction. It means they retract the maxilla and the they retract the maxilla and the maxillary dentation in the distal direction. And they are the cervical headgears. They are indicated in case of low mandibular angle cases. Again, important. Now second are the occipital headgear. So they take the anchorage from the back of the head. The high pull headgear, they produce the vertically directed force. They decrease the vertical development of the maxilla. Very important, the occipital or the high pull headgear, these are indicated in the patient having a long face, as in the class 2 patient with the open bite tendency. Important. Third are the combination. So this is the combination headgear. In this type of headgear, the occipital as well as the cervical anchorage is combined. Okay. Next is the vertical pull headgear. So it derives the anchorage from the parietal region of the cranium. Important. And it is beneficial in the treatment of the vertical maxillary anterior axis and in the gummy smile. Gummy smile is very important, commonly asked MCQ. Well, next is the asymmetrical headgear. So the asymmetrical headgear, these are used, for example, in a patient if it is having a class 2 molar on one side and class 1 molar on another side. So in this case, we use the asymmetric headgear. The differential force values, these are produced by altering the length of the outer bow on each side. Right? So this is the asymmetrical headgear. So basically these are 5 types of headgear. Cervical, it causes the extrusion of the maxillary molar, leads to the increase in the lower facial height, and it is indicated in the low mandibular angle cases. The occipital headgear, it is also called as an high pull headgear. It is basically used, or it is basically indicated in the long face class 2 patient having an open bite tendency. And the vertical pull headgear, it is used or it is indicated in a gummy smile. These 3 are very important. Coming on to the uses of the headgear, so it causes the orthopedic effect. So in this, the force applied onto the maxilla, which is used to restrict its downward and forward growth. Fine. So the force is about 350 to 450 grams on each side, and the headgear, the duration of the headgear is 12 to 14 hours a day. Third important point is the orthopedic effect from the extraoral forces. These are best seen in pre-adolescent years. Important. It is also used in anchorage augmentation, for the distalization of the molars, for the molar rotation, and it also acts as a space maintainer. And sixth one is, it is also used for controlling the cant of occlusal plane. Right? So this is all about the headgear. Second is the face mask. So face mask, it is also called as a reverse pull headgear. Important. Why it is called as reverse pull headgear? Because it is given in class 3 patients with the retrognathic maxilla. Important. Right? So the face mask, it was given by Hickam in 1972. So the face mask, it takes the anchorage from the chin, from the forehead. This is the face mask. Right? So in this amount of these are some of the biomechanical considerations in which these are very important. The amount of force is about 1 pound, that is 450 grams per side. Duration of the force is 15 degree to 20 degree downward to the occlusal plane. The duration of force is the low force, which is 250 grams per side for 13 months. Very heavy force, that is 1600 to 3000 grams for 4 to 21 days. Important. And the frequency of use is, the duration is 12 to 14 hours per day. Important. Now in this we have 3 types of your face mask. We have the Delaire face mask, Tubinger and Petit. Starting with the first, that is the Delaire. So this was popularized by the Delaire in 60s. Right? So it also uses the chin and a forehead for the support. So this is an appliance which is made up of a rigid arch wires, and it is square in shape. The appliance, it is made up of rigid wire framework and it is squarish in shape. And important point, it is kept away from the face. So it has a forehead cap, it has a chin cup, and apart from the forehead cap and a chin cup, there is a wire. This is a wire which is running in front of the mouth. The basic purpose of this wire is for the elastic attachment. Important. Fine. Next is the Tubinger model. So it is a modified type of a Delaire face mask. It consists of a chin cup, from which it originates into the 2 long rods, and that run the midline, and it is shaped to ovoid. It's shaped to avoid for the interference of the nose. Fine. So in this, the superior end, these are the superior end of the rod. These are housed in the forehead cap. In addition to this, an cross extended bar is present in front of the mouth, which is helpful for engaging the elastics. Fine. And last is the Petit type of the face mask. This is also called as modified Delaire face mask. Fine. So it consists of a chin cup. This is a chin cup, a forehead cap with a single rod. This is the single rod which is running in the midline from the forehead cap to the chin cup. This is a single midline which is running from the forehead cap to the chin cup, and this is the crossbar at the level of the mouth for engaging the elastics. So the advantage is the forehead cap and the chin cup and the crossbar, it can be adjusted to suit the patient. These are adjustable. This is the advantage of the padded face mask. Right? So this is all about the face mask. Last is the chin cup. So the chin cup, it is used to restrict the forward and the downward growth of the mandible. Basically it is used to redirect the growth of the mandible. Fine. So chin cup, it is of two types, the occipital chin cup and the vertical pull chin cup. So the occipital pull chin cup, it derives the anchorage from the head. Occipital means it derives the anchorage from the head. It is used in case of class 3 malocclusion with the mild to moderate mandibular prognathism. Important. And occipital pull chin cup, it is indicated in the patient with a slightly protrusive lateral incisor. Very important point. Next is the vertical pull chin cup. So it derives the anchorage from the parietal region of the head, and it is indicated in the patient with the steep mandibular plane angle. Important. And it is also indicated in the patient having an excessive anterior facial height. Again important. Fine. And these patients usually exhibit an anterior open bite. Commonly asked MCQ. So lastly, the important points are, at the time of the appliance delivery, the force is 150 to 300 grams per side. Over the next 2 months, the force is increased to 450 to 700 grams per side, and the duration is 12 to 14 hours a day. Right? So guys, this is all about the orthopedic appliances. Important topic. Please go through it once and try to make the notes. Thank you.